If you or someone you love has had a stent placed in the heart, you were probably told it would fix the blockage. And in that moment, it did. But here's what most people don't hear in the recovery room. A stent is not a cure. It's a chance. A chance to rewrite your story. I'm Dr. William Harris. I've been a geriatrician for 38 years, and I've walked alongside hundreds of patients after their stent procedures. Some thrived for decades. Others were back in the cath lab within a few years. The difference? It wasn't luck. It was what happened after the procedure. Today, I want to share the truth about how long stents really last, what can go wrong, and, most importantly, the gentle, science-backed steps that can help your stent and your heart go the distance. I want to share the truth about how long stents really last, what can go wrong, and, most importantly, the gentle, science-backed steps that can help your stent and your heart go the distance. Let's begin. Let me tell you about Mr. Gerald Thompson. He came to see me 6 months after receiving a drug-eluting stent in his left anterior descending artery, what we call the widowmaker. He'd had classic crushing chest pain, and the emergency team saved his life. When I met him, he was frustrated. He said, "Doc, I thought the stent was supposed to fix me. Why do I still need all these pills? Why can't I eat what I want?" I pulled up a chair. I told him what I'm going to tell you now. The stent opened the road. But the road is still inside a body that built that blockage in the first place. The atherosclerosis, the plaque, didn't vanish. It's still lining the walls of your arteries, upstream and downstream from that little metal tube. Gerald's face changed. He realized the stent bought him time. What he did with that time would determine whether he got to walk his granddaughter down the aisle or end up back on the table. 2 years later, Gerald is thriving. He walks every morning. He takes his aspirin and statin without fail. He swapped his bacon and eggs for oatmeal with walnuts. He didn't become perfect, but he became consistent. And that, my friends, is the entire game. Here's the first thing worth reconsidering. A stent is not like a hip replacement. It doesn't take over the job. It props open an artery, but that artery is alive, dynamic, and still vulnerable. There are two main types of stents. Bare metal stents, which were common 20 years ago. These had a 20 to 30% chance of re-narrowing within the first year. Why? Because the body saw the metal as foreign and tried to heal around it, creating scar tissue that clogged the artery again. Drug-eluting stents, which release medication slowly to prevent that scar tissue. Modern versions, coated with drugs like everolimus or zodorolimus, have brought restenosis rates down to just 2 to 3% at 5 years. But here's the catch. Even with the best stent, 10 to 15% of patients will experience some degree of re-narrowing within 5 years. And it often happens silently. No chest pain, no warning. Just a gradual return of fatigue or shortness of breath. Think of it this way. The stent is like a support beam in an old house. It holds up one section beautifully, but if the foundation is still crumbling, other rooms will start to sag. Your entire vascular system is the house. The stent is just one beam. Let's talk about the pills. I know, nobody wants to take medication forever. But here's my clinical observation after nearly 4 decades. The patients who do well are the ones who treat their pills like oxygen. After a stent, you'll be prescribed aspirin to keep platelets from clumping clopidogrel, Plavix, or ticagrelor, a second antiplatelet drug, a statin, to lower cholesterol and stabilize plaque. These aren't optional. They are the minimum required to keep that stent open and prevent what we call stent thrombosis, a sudden blood clot that can block the artery entirely. This is a life-threatening emergency, and it can happen months or even years after the procedure if you stop your medications. I've seen it. A patient feels great, decides they don't need the pills anymore, stops taking them, and 2 weeks later they're back in the ER with a heart attack. The stent is metal. It doesn't heal. It doesn't adapt. It just sits there. Your blood and your choices determine whether it stays open. If cost is an issue, talk to your doctor. If side effects are a problem, talk to your doctor. But please, don't just stop. Here's the third thing. A stent does not prevent new blockages. Let's say your stent is in the right coronary artery. That's fixed, for now. But you have 3 major coronary arteries and dozens of smaller branches. If the same habits that caused the first blockage continue, plaque will keep building elsewhere. In long-term studies, about 40% of stent patients need another procedure within 15 years, often in a completely different artery. So what actually works? The Mediterranean diet. Study after study shows it reduces cardiovascular events by 30%. That means more olive oil, fatty fish, nuts, vegetables, whole grains. Less red meat, butter, and processed foods. Daily movement. Even 20 to 30 minutes of walking improves endothelial function, the inner lining of your arteries. It's like oiling the gears. Stress management. Chronic stress raises cortisol, which raises blood sugar and blood pressure, both burdens on your stent and your heart. No smoking. Ever. Even 1 cigarette activates platelets and increases clot risk. If you smoke, quitting is the single most important thing you can do. I tell my patients, the stent opened the door. Lifestyle keeps it open. So what does this look like in real life? Let me give you some gentle swaps I recommend. Breakfast. Instead of bacon, eggs, white toast. Try oatmeal with walnuts, blueberries, and a drizzle of honey. Add ground flaxseed for omega-3s. Lunch. Instead of deli sandwich with processed meat. Try a large salad with chickpeas, olive oil, lemon, and grilled salmon or chicken. Dinner. Instead of steak and potatoes. Try baked cod with roasted vegetables and quinoa. Use garlic, turmeric, and herbs liberally. Snacks. Instead of chips or cookies. Try a handful of almonds, an apple with almond butter, or carrot sticks with hummus. Movement. Start with 10 minutes after each meal. Just a walk around the block. Gradually build to 30 minutes most days. Medications. Set a phone alarm. Use a pill organizer. Tie it to a daily habit, like brushing your teeth. Follow-ups. If you develop new chest discomfort, unusual fatigue, or shortness of breath, call your doctor. A stress test or CT angiogram can catch problems early. These aren't drastic, they're doable, and they work. Here's what I'd like you to consider. A 14-day gentle reset. For 2 weeks, take your medications every single day, no skipping. Eat at least 1 Mediterranean-style meal daily. Walk for 15 minutes after breakfast or dinner. Write down how you feel, energy, mood, breathing. You're not committing to perfection. You're gathering data on your own body. At the end of 14 days, ask yourself, do I feel different? Most of my patients say yes, and that yes becomes the fuel for month 2, month 6, year 1. Small hinges swing big doors. This is your hinge. Before we close, I want to leave you with a recipe idea that several of my patients love. Mediterranean baked salmon. Salmon fillet. Olive oil, lemon juice, minced garlic. Fresh dill or parsley. Roasted cherry tomatoes and asparagus on the side. Bake at 375 degrees Fahrenheit for 15 to 18 minutes. Simple. Delicious. Heart healthy. If you found this helpful, I'd be honored if you'd subscribe and turn on notifications. Every week, I share evidence-based guidance for living well after 50 and after procedures like stents. Drop a comment below. Have you or a loved one had a stent? What's been your biggest challenge in the recovery journey? I read every comment. You're not alone in this. Until next time, take care of that beautiful heart of yours. I'll see you soon.